What is this organ first? We see lots of muscle layers of cells, well demarcated, good supply of blood, multiple vessels inside, and what else? What should this organ be? Now let's take a look at the epithelium, which is strictly on multiple layers and it's forming papillary structures. So, it's here, which is the normal one. Take a look at this one now. Here, this is the usual urothelium and how it's looking like. Is it gone again? Yeah, it's urothelium. Thank you, Amal. So this one is urothelium. And later, we continue to other fields inside the tumor, where the urothelium is on much more than 7 layers of cells, which we usually should expect to see. It's forming papillary structures, small lines of stroma in between the structures, which are actually fibrovascular stroma fields. They are feeding these papillary structures. And when we increase the cells, we observe that they are on multiple layers. Lots of mitotic figures might be observed. Also, what else we observe is that these cells are polymorphous. They're different from each other. The nuclei are different and appear with dispersed chromatin centrally. Here and there, you might be able to observe even a couple of nucleoli, if you will. What else? We move further to the slide, where we could prove that this is actually urinary bladder that you're observing. How? By the strands of muscle cells. Usually the muscle cells in the urinary bladder should appear on 3 layers. This one is sagittally cut, this one is longitudinal, and here again we have appearances of sagittally cut. Since we see tumor fields on both of the muscle layers sides, we might suggest that this type of tumor is multifocal and an invasive one in the wall of the urinary bladder, which will cause changes in the stages of the tumor, the grading and the staging. Usually, urothelial tumors are graded as high grade and low grade tumors. This one is in a high grade because it appears on too many layers than usually they are. It has some fields of low grade tumor differentiation. Again, disappeared. Great. Thank you. But most of the fields of the tumor are appearing to be high-grade differentiated. Vascular fields, very well observed. Places of fibrosis in between the muscle cells. And pretty much that is all. So the invasion peripherally here suggests that the tumor is invasive itself. But since we don't have appearance which is gross, this type of tumor, we don't have appearance which might suggest exactly how this slide was cut. It might be on a superficial field of this urinary bladder. I myself would never be sure whether this is an invasive tumor or not by just one slide. You might suggest it, you might give it as a suggestion to the professor, but you should mention the idea that you need more slides to prove whether this tumor is invasive in the wall of the muscle cells and whether this would change the staging of the tumor, not just the grading by the look and the appearance of the cells. Of course, here again, We should mention all of the features of cellular atypia, which might be larger number of mitotic figures, disturbed nuclear cytoplasmic ratio, polymorphic cells, different cells, cells with a couple of nuclei inside. Also, presence of nucleoli centrally in some cells might be observed, eosinophilic nucleoli. Also, such stuff that we usually mention about malignant tumors. Um, Here you might be asked about etiology of this type of tumor. Here you might be asked about whether there are some specific stuff to be causing. What is the etiology of this tumor? Can you remember? I believe you're now studying about your exam, so I think that you might have read some stuff about it. What is the appears to be the cause for this type of tumor? Most oftentimes. Cigarette abuse, one, yep, smoking majorly in women, and also smoking, yeah, hypertension, obesity, sometimes paints, aniline paints, something like this. Paints on houses, inhalation of these paints, and the mechanism of movement of toxins through blood affects the urinary bladder, and finally there develops urinary tumor. So also such etiology should be considered. What else? Majorly that's it. Often inflammation. Squamous cell metaplasia often might be observed here inside in this type of tumor and might be the cause for this one. Also, formation of stones, stasis of urine, previous chronic cystitis, predominant chronic changes inside might be the cause for formation of urinary bladder tumor. Majorly, those are the stuff. And you should not miss the other places where transitional type of malignancy may be developed, such as the renal pelvis, the ureter, the urethra. All of these places are covered by transitional epithelium. So you should have all this in mind. Okay, so I think that's most of stuff that we should mention about this type of tumor. Let's continue with the next one.